Hi, so my name's Tess. I'm one of the nurses. Today we're just going to be talking about Parkinson's disease, the pathophysiology of Parkinson's disease, and the pharmacology behind it and how to treat it. So Parkinson's disease can be defined as 4 cardinal motor symptoms: tremor, at rest, bradykinesia, so slow movements, rigidity and postural instability. It is also characterized by a variety of non-motor symptoms, which include constipation, depression, dementia, and anosmia, and sleep disorders. Studies have shown that there are 3 major cellular pathways that are interconnected and can be altered with Parkinson's disease pathogenesis. So let's look at Parkinson's disease, but at a cellular level. So at a cellular level, there is neuron degeneration. So when we look at Parkinson's at a cellular level, we need to look at what happens to the dopamine neurons within the brain. So as we can see here, you have your normal neuron within the brain and you have lots of dopamine receptors going from the neuron to the receiving end, so which is the normal movement of your everyday person. So at this end of, you've got your neuron and then your other end of your synapse, and you've got lots of dopamine receptors. In a Parkinson's affected patient, we don't have as many dopamine receptors heading to the other end of the synapse, which is when we get the tremors, the slow movement, the rigidity movement. So that is all happening at a cellular level. So when you see a patient with Parkinson's disease, this is what is happening within their brain. So Parkinson's disease can be pathologically characterized by the loss of the dopamine innervation. This also involves areas of the neural networks. So there is a loss of the dopamine receptors within the brain, and this affects their everyday movement, life, everyday activities. So there is a theoretical framework that has been researched, and this suggests that Parkinson's disease as caused by the dysfunction of the entire basal ganglia cortex and the cerebellum system rather than by the basal ganglia in isolation. So this means that within the brain you have the basal ganglia cortex, the basal ganglia. It is suggesting that Parkinson's disease also involves the cortex and the cerebellum, not just the basal ganglia on its own. So to treat Parkinson's disease, because unfortunately there is no cure, there are lots of different treatments and different medications that are used. However, for our patient today, Emma, she has a type of Parkinson's that requires a certain medication. We'll get into that. So treatment for Parkinson's will often begin with a pharmacological dopamine replacement strategy, because the dopamine delivers messages throughout the central nervous system. There are several neuropsychiatric symptoms that are related to the emotional and cognitive related problems. So these symptoms are often significant to the disruption that contributes to this disability. Apomorphine is a subcutaneous injection. This is a dopamine agonist with a string affinity to the D1 and D2 receptors. So this is the medication that Emma will be using. So this is apomorphine, again at essentially a cellular level. When you look at the chemical makeup of apomorphine, this is what we're looking at. So this drug is a part of the dopamine agonist drug class. Dopamine agonist is acting on the pre and postsynaptic D2 receptors and is antagonizing the alpha 2 adrenic receptors. So this is used as a subcutaneous injection, like an insulin injection, very small needle just under the skin. Nursing considerations with this medication, you need to have a baseline assessment done. So before you're given this medication, as a nurse, you need to perform this baseline assessment. This is how they move, how they do basic things. You also need to be monitoring their FBC and hepatic, renal, and cardiovascular function during this medication. The patient must be hospitalized during the pre-treatment phase. So for the initial few days of having this treatment, they need to be hospitalized, so you can refer back to the baseline the baseline assessment you did before the treatment started. So this medication is typically used because apomorphine has a significant improvement in motor and non-motor symptoms. In relation to Emma, apomorphine should improve some of her tremors, slow rigid body movements, and instability that she has referenced that she is suffering from. However, Emma does need to be educated with how any type of medication, especially this medication that's for Parkinson's, there is no cure. This medication is to help reduce her symptoms, however, she will still experience some of these symptoms. So that is all for today. If you have any questions, just let me know. I'm always happy to help. Thanks.